Hello everyone, my name is Mimi Kang and I will be presenting Health Promotion Teaching and Plan on Human Immunodeficiency Virus, HIV Education, and Screening for Young Women in Africa. There are many countries in Africa that are impacted by high number of new infections and deaths due to HIV. Out of those many countries, HIV-related data from 5 countries in Africa, along with the impact on African women, are discussed in this slide to give you an example of what we're dealing with. According to statistical information in 2016 of Eastern and South Africa, this region was the hardest hit by HIV. Data reported 960,000 new infections occurring, the highest among young women between the ages of 15 and 24. Among these, 4,500 women reported with new infections every week. According to statistics in Botswana, 200,000 people out of 360,000 people living with HIV were women. South Africa is to have the biggest and most high profile of HIV in the world. 570 young women of Uganda between the ages of 15 to 24 acquired HIV every week. To prevent further increases in these statistical data on African women, education and screening for HIV to women is an important intervention. There are many factors that contribute to increased African women's vulnerability to contracting HIV. Thorough assessment of learning needs should be conducted to determine what contributes to development of HIV. Due to the impoverished living of the African communities, many women do not receive the proper education on HIV/AIDS and have their own cultural beliefs and practices on sexuality that puts them at greater risk for HIV. Behavior needs assessments include methods of protection such as abstinence, delaying sexual debut, condoms, safe sex, monogamy, reduction of partners or early screenings, and what their sexual practices are. Other important learning needs assessments are socioeconomic, cultural, structural, and psychosocial needs. Nola Pender's health promotion model will be used for patient education plan on HIV. The 3 stages of education will help guide the development of the teaching plan. The 3 stages are individual characteristics and experiences on HIV, behavior-specific cognitions and affect, and behavioral outcome. After interviewing the patient and collecting data based on what the patient states, we're able to determine their understanding and beliefs on HIV. Healthcare providers are able to develop a plan according to the learning needs of the patient. A goal that we would focus on would be that patient will be able to verbalize safe sex practices by the end of the health education and promotion course. 3 behavioral outcomes that will indicate that the teaching plan has been successful would be that patient uses a condom, follows medication and treatment regimen, and has one sexual partner. The 3 evidence-based paper articles that identify the desired behavior outcome as a result of the teaching plan is shown above. The first research evidence shows that performing safe sex practices such as the use of condom is an important factor in prevention of and contracting the disease. This would be taught in the individual characteristics and experiences phase. The second research evidence shows that following medication and treatment regimen is an important factor to teach the patient, which would have been performed in the individual characteristics and experiences phase. The last research evidence indicates that having multiple sex partners is one of many HIV risk behaviors. This would be addressed in the interpersonal influences in the behavior-specific cognitions and affect phase. There are several ways to evaluate the effectiveness of teaching. We can test patient knowledge and understanding of the health promotion teachings through the feedback method. Patients can verbalize their understandings and demonstrate by showing how to perform uses and following medication regimen. Having patients verbalize and demonstrate teachings will help them recall what they were taught and build a stronger understanding of HIV prevention. The success of health promotion teachings and plan can be measured through patient participation in frequent screenings and treatment medication regimen. Psychosocial assessments will help healthcare team to measure success from barriers that were caused by situational or interpersonal influences that may have put the patient at risk for HIV. The number of people impacted by increasing transmission of HIV and AIDS is a great concern in Africa. Through effective health promotion teaching and plan, promotion of positive sexual behaviors and life skills to prevent further transmission is necessary. Many people in Africa are living in poor conditions with the lack of education. Patient education and understanding is an important factor in prevention of HIV and health improvement. Communities in Africa need to come together to increase their community involvement and knowledge and spread of HIV and AIDS to prevent increasing deaths associated with HIV and AIDS. And the last page is a list of references used for this presentation.